So we're here, first day of RSNA 2012 in the CareStream booth, and joining me I have Vasko, who is the digital media editor at ImagingBiz. I'm so thankful that you were able to take some time out of your schedule to talk to us today. You've been very busy. I know you've been in a lot of sessions, touring a lot of exhibits. You had an opportunity to go to the Keynote session this morning. I think everyone left that feeling really energized and enthused.
Absolutely.
Can you share a little bit about your impressions from that keynote
Sure.
and what you kind of took away from it?
Sure, absolutely. One of the things that I think was most striking is that usually at this keynote there is the president of RSNA introducing 3 speakers from the world of radiology. And this year the 3 speakers were not from the world of radiology. One was actually a patient advocate and 2 were non-radiologist clinicians. And I think that there's something signaled there,
Right.
which is obviously the theme of this year's RSNA is patients first. And I think the specialty is really beginning to expand its focus to more collaboration, more interaction, and more engagement with areas outside of radiology, both clinical and patient focused.
And there was a lot of discussion that we heard as people came into our booth on this shift from technologists and reporting to again more of a consultant model of care.
Yeah.
Is that something that you think is a trend?
Yeah, absolutely. I mean, I think a lot of the macroeconomic specialists in the field would tell you that radiology faces the same path as pathology, where it's largely become commoditized because it's a service, unless radiologists can really insert themselves into the care continuum as consultants.
Sure.
And I think from the technology side, there's a feeling that about as much efficiency as can be has been eked out of radiologists' workflow at this point. So it's more about how do we enhance the other parts of their job and make it easier for them to do those.
Right, that's great. Now, as radiologists and the specialty starts to get more patient focused, there's different aspects to how you're going to achieve that. And so there's a combination to things that you may practices that you may put into place in your practice, but there's also technology solutions and things that can help you achieve that. The big buzzword here is patient portals.
Right.
You're hearing that everywhere. Any impressions on patient portals that you've had at the show, or just as you've kind of been following that space?
Well, I think this new emphasis on patient portals reflects the fact that people realize that in some ways, in the consumer sphere, people are more sophisticated in their use of information technology than we are in the healthcare sphere. People use more sophisticated devices in their homes than can be seen in a lot of doctors' offices. And so it reflects, as we look at more consumer-driven healthcare and as economically the consumer becomes a much bigger factor, it reflects what people are looking for, which is the ability to be able to go online and deal with their healthcare the same way they can go online and deal with just about anything else.
Online banking.
Online travel.
Yeah, absolutely.
So yeah, I mean, I think it's a pretty natural progression.
Right. So you've been to a few RSNAs.
Yeah,
You're first. How do you feel about the energy at this year's show? Do you think it's an exciting time? Are people
I think it is. I mean, I think what we're seeing now is a profession that's gone through a lot of upheaval.
Yeah.
And obviously there were a few years where we felt pretty grim about that because there were a lot of changes, but I think now people are focused more on the opportunities that this creates. And the opening session, kind of bringing it full circle, really showed that. I mean, people were really inspired by the stories of these patients whose lives have been changed through imaging.
Yeah.
And that's kind of what it's all about. And sometimes in the day-to-day of keeping track of all the changes, you can forget that. But when you think of how transformative it can be, it's very exciting and inspiring.
Great. Well, thank you for taking some time with us.
Sure,
we hope you have
thank you.
a great show, and definitely follow Kat's reporting online. She's been doing some great blogs and great coverage, so thanks.
Thank you.